Dental implant is essentially a titanium root to replace the root that you once had, which will allow the attachment of the crown of the tooth that you're missing. We are able to provide that service to our patients in the form of a single tooth dental implant or multiple implants. In some situations, patients are missing all their teeth or need all of their teeth extracted and are confronted with wearing complete dentures. There's ways to place dental implants that'll allow a denture to snap onto it so it stays in the mouth better. And then we go as far as being able to provide multiple implants that will hold a dental bridge and replace all the missing teeth with something that stays in their mouth and doesn't come out. At Lancaster and Lebanon Oral Surgery, we place 99% of our implants in a guided fashion, which means we get information from the patient in the form of a three-dimensional x-ray, a digital impression of their teeth, and that allows us to plan where the implant is going to go before it's ever placed. And we are then able to place that implant using a surgical guide into the location that best allows their restoring dentist to put the final crown onto the implant. Typically, what they can expect is an initial consultation appointment where we'll discuss the steps involved with the dental implant, and oftentimes we're able to remove a diseased tooth and place an implant at the same time if the conditions warrant. As oral and maxillofacial surgeons, we go through anywhere from 4 to 5 to 6 years of residency training after our dental school training, which allows us to not only place dental implants safely and properly, but also manage any complications that may arise after the placement of an implant if that were to occur. A lot of times patients will ask, how long is this going to take to have this dental implant placed? Now, there's some appointments surrounding preparing the patient to have an implant placed, but the actual placement of an implant, because we do it with this guided system, a typical implant may take 20 to 30 minutes. Recovery for dental implants can vary on how many implants were placed, whether there was additional procedures such as bone grafting that needed to be performed at the same time. For a single tooth, straightforward implant, typically most patients are able to go about their normal daily activities by the next day. Sometimes they may require a softer diet and some softer foods for a couple days beforehand, but oftentimes they're ready to get back to living their life and doing what they were doing before within a couple days. Another advantage of a single tooth implant is once that implant is placed, you can treat that tooth as you would the previous tooth. You can brush around it and floss around it and eat the same way you were before you had lost that tooth.